Hey, I know a lot of you are probably wondering how healthcare will work when no money is being passed from hand to hand. Just like with any other production that's still going to take place, as like carpentry and farming, things like that, nursing and doctors will be something that will still be quite necessary. All the people who really love to do that, they can do it, but they're not made to do it for a certain amount of hours. Everyone can do what they can, and it doesn't have to be this thing where if you're sick, you have to show up anyway because you've missed all of your sick days. All of that will dissipate, it will not exist anymore. So we will roboticize all the jobs that can be roboticized. Millions of people will be set free from the burden of physical labor. All the people who love to do what they do, architects, there of course will be programs for that. We already have programs for them, but there are people with new ideas. They're called architects, and they will still be able to do what they do. Interior designs will still be able to do what they do. Artists, singers, actors, they can all still do what they love to do. And if they really love to do it, when the money's taken away, they'll continue to do it. This is how you'll know who really enjoys what they do. So, all the nurses out there, all the people who ever wanted to become a nurse, now you can become a nurse or a doctor and you will get an actual education. It won't be an agenda that is geared towards medicating people. It will be an agenda that is geared towards preventing illness and disease. And when it does pop up, we naturally handle it because all of the pills that you take now all came from a natural idea. So they all came from nature. They all have something that is based in nature, and they extract the chemicals that they need from whatever it is, and they use it in a pill form to medicate you. But the only difference in this natural medication and the pill medication they're giving you is process after process after process, plus the adding of fluoride because all pressed pills use plenty of water. The dyes, the colors, the coatings that help it dissolve at a certain speed, or it's just ridiculous, the list of things that go into your pills. So those will cease to exist. For those of you who think you will die without them, I promise you that you will not. People who need dialysis, that will not stop. Nobody's going to die when the money stops. There will be systems in place to take care of that. And the healthcare system is not something you'll have to worry about anymore. Insurance isn't something you'll have to worry about having. And when money's gone, you'll really be free to do more. You're not worried about, oh, what if this happens? What if that happens? You can take that risk, take that chance. If you've always wanted to go cliff diving, but you're scared to death, or, try skateboarding or BMXing, whatever it is. Some people are actually just too worried that they're going to hurt themselves to do anything. But when you take the inability to be healed, like we have today, a lot of people have to deal with leaving amputated limbs, fingers and toes and whatnot behind because they just can't afford to get them reattached. And that's pathetic. That's pathetic. We're not barbarians, but we act like it. So it's time we stopped. The people who love what they do can continue to do what they do, including healthcare workers. And you will have a much better experience because the people that are there are going to be happy. They're not miserable to be at their jobs. They're not made to be there. They're not dead on their feet and so tired. They would have gone long before that happened. 4-hour shifts, 5-hour shifts, that should be the max for a normal human being. And it shouldn't be 5 days a week. It should be like 3 days a week, max. You should be able to work 5 to 6 hours a day, 2 to 3 days a week, and that should be the most you can work. The way that we work now, it's to support all the massive overproduction, and we don't need that. That's pollution and it's waste, and we don't need it. A bunch of bullshit products made to break down quickly, that's all going to stop. So the healthcare system will be so much better because the people working there will be happier. They'll be doing it for the right reason because they actually want to help you, not because they're making money. And And you'll have a better experience when you're there because you will have top-notch medical care. Nothing will be out of your reach. There will be nothing you can't pay for because your insurance doesn't cover it. Everybody, 100% across the board, gets everything taken care of all of the time. There's nothing to worry about. You're sick, you're injured, it's not a problem. It's not a worry. Our lives will change so much exponentially when we don't have all of these unnecessary worries and burdens on us. We shouldn't have to be dealing with that. We have other things to deal with, like raising our children, growing food, educating ourselves, exploring the universe, figuring out how our bodies work, determining how we got here, why we're here. I mean, there's so many other things we could be focusing on rather than wondering how we're going to get our finger put back on. It doesn't make any sense to me. So don't worry, I got you guys. Just embrace what happens. Be happy, relax when it happens. Healthcare will be nothing you have to worry about, okay? Nothing. You guys take care.